Hello everyone, my name's Ken Donaldson. I'm the Medical Director here at NHS Dumfries and Galloway. I'd like to talk to you about the extreme pressures that we're currently experiencing across our health and social care partnership. As I don't need to remind any of you the difficulties we've been experiencing over the last 18 months with the COVID pandemic and the amount of changes we've all had to make to our lives to accommodate the restrictions that have been put in place. Whilst these are relaxing around kind of society in general, we still have restrictions in place in the healthcare that are necessary to keep both staff and members of the public safe. So thankfully, due to the success of our vaccination programme, we are starting to see a reduction in positive COVID cases, and more significantly, that people who get COVID tend to be far less sick than they were before. And this really heralds what we hope is going to be the return to normality in general. However, the changes that we have made in the last 18 months in health and social care still are having major effects on the number of patients that we can see in our hospital and how we are caring for patients in the community. And these are impacting, as I say, across the entire partnership, whether that's care at home or care homes or in primary care, in mental health or in the hospital itself. The pressures currently are everywhere. And to be honest, there is no sign that these are going to let up anytime soon. I think for the next few months, if not well into next year, we're going to be really dealing with a backlog of patients that we know need to be dealt with, and that's going to take us a significant amount of time. It's a message that I've given out myself and others have done throughout the pandemic, but if you can, when you need any healthcare advice, if you can use NHS Inform online or phone NHS 24 through 111, or indeed, popping into the pharmacy to get advice, we would encourage that. But also we recognise that many patients do need to seek healthcare from either a GP or in the hospital, and please, everything is there if you need it. It just is under pressure and it may take a bit longer for you to be seen. A point about primary care, there has been a bit of dialogue over the last 18 months that GPs haven't been seeing anybody, and what are GPs doing? And this is a myth I would like to bust, because throughout the pandemic, GPs have been seeing patients face to face. Maybe not as many as before the pandemic, but that's purely down to the restrictions that they had to follow. So there were more telephone consultations. This has really led to the point now where GPs are busier than they have ever been. They're dealing with far more patient contacts on a day-to-day basis than prior to the pandemic. And this, as you can imagine, is taking its toll on primary care. And I would urge all members of the public, when contacting your GP practice, to keep this in mind. It's not the staff's fault that things are so busy, it's just a reflection of how the pressures are there throughout the system. And I guess that goes for any part of the system. When anybody's making any contact, just to remember the staff have been dealing with extraordinary pressures for a long period of time. And as I said earlier, there's no obvious let up in sight in the future. And I think we as a community, it's been obvious throughout the pandemic that we have come together and worked as a community to get us through this, and we need to keep that aspect of all working together for some time to come. I'd just like to end this by saying thank you to all the staff, and I mean all staff, whether that's working in care homes or care at home, in third sector, volunteers across primary and community care, to, as I say, mental health and the acute sector, everybody. You're all working, as I said earlier, and under extreme pressure. But what I see on a day-to-day basis is teams coming together, recognising this pressure, looking after each other, and doing their absolute utmost to deliver the best care they can to our patients. So I just want to thank you all for everything you're doing, and take care of yourselves.